Hello everyone, my name is Veronica Kamau, a DNP student at Maryville University. Today, I'm going to present my DNP Quality Improvement Project that focused on evaluating the impact of staff alerts in improving the pre-appointment patient health questionnaire, popularly known as the PHQ-9 form completion rates. The project was made possible by the support of committee members that included my chair, Dr. Tyreen Sandhendrich, second reader, Dr. Dawn Martis, and community member, Dr. Patience Morican. Background and significance. Major depressive disorder is a chronic global mental health diagnosis that affects people of all ages and backgrounds. Depression is more common in females than males. It is more prevalent in adults between the ages of 18 and 25. According to the World Health Organization, in 2023, 280 million people suffered from depression worldwide. The United States Department of Health and Human Services reported in 2023, 21.0 million adults had experienced a depressive episode. In 2022, out of 21.9 individuals with drug overdose, 12.9% of them had major depressive disorder. In California, 16.3 million adults had depression, and higher rates were prevalent in the areas where the project was conducted. Therefore, using a valid and reliable evidence-based assessment tool like the PHQ-9 questionnaire can help assess, monitor, and manage the severity of depressive symptoms in patients. Significance of staff alerts and monitoring of symptoms. It encourages effective communication between providers and the patients. Evidence-based tool helps patients to express themselves without fear of judgment or stigmatization. When patients complete their assessments before the appointment, it helps the provider know the level of care needed and have better treatment plans. Additionally, practices that have low pre-appointment completion rates prevents the provider from giving better patient care. For this project, the aim of using staff alerts was to encourage patients to be engaged more in their care prior to the appointment and also improve their outcomes. Review of literature. Literature review entails comprehensive survey, critical analysis, and synthesis of existing scholarly literature on a specific research topic. It is the consolidation of information across multiple research resources that help generate a new understanding to a clinical problem. Literature review facilitates the evaluation, comparison, and identification of threats, gaps, and themes in research. In order to complete literature review and synthesis, literature search regarding a clinical problems need to be completed. Literature search requires identifying themes related to the question of inquiry. Different search engines, keywords, and phrases are used to generate relevant research articles for literature review and synthesis. Literature analysis helps identify strengths, weaknesses, gaps, and limitations of the articles used. Gaps in evidence are unanswered questions related to a practice problem. Additionally, gaps in evidence are caused by incomplete, inconsistent, or insufficient evidence or information. Inconsistent, incomplete, or insufficient evidence hinders making research conclusions. It also prevents transfer of knowledge and use of evidence-based care for practice. Likewise, literature review helps explain concepts and definitions found in research. Concepts and definitions are phrases or terminologies that are used in research and are not familiar to all readers. Definitions and concepts is provided to improve reader understanding of the clinical problem. For this project, different search engines that included Ovid Synthesis, the Maryville Library Database, PubMed, CINAHL, Medline, and Google Scholar were used. Keywords and phrases included PHQ-9 and staff alerts, PHQ-9 and staff reminders, PHQ-9 and automation, PHQ-9 and adult depression, reminders and patient form completion, and PHQ-9 and staff alerts and staff reminders and staff form completion. Articles that were used were full, written in English, and were within the last 7 years, and used alerts and reminders in different clinical settings. Theoretical framework. A theoretical framework is a foundational structure composed of existing theories, concepts, and definitions that guide and inform a research study. It is a roadmap that helps researchers connect their work to established knowledge and build upon existing theories. For this scholarly project, the Catt-Lewins change model was used. The Catt-Lewins change model has 3 stages. The first stage of the change model is the unfreezing. This is the preparation stage, which entails the identification of a problem and prepares the stakeholders for change. This stage focuses on communicating the why change is needed. Unfreezing helps decrease resistance to change. For this project, staff training was conducted about the importance of PHQ-9 and the need for a standardized form completion procedure. Training staff helped identify barriers and how to overcome them, and encourage staff engagement in the change process. The second stage of the model is the moving stage. This involves the actual implementation of the intervention or proposed change. To be successful, open and supportive communication among the stakeholders is required. Communication and support removes any uncertainties and weakens resistance to change. For this project, staff alerts were implemented in the clinical workflow. Staff support provided, which improved compliance with the change implementation. The third stage is the refreezing. Refreezing ensures implemented changes are maintained and prevents people from going back to their old behaviors and habits. It aims at maintaining the implemented status quo as part of the organizational structure. Policy changes, as well as continuing with staff reminders as part of daily routine, will be maintained to improve the pre-appointment PHQ-9 form completion. Stakeholders being at an equilibrium sustains organizational change. The clinic where the project was conducted is in the process of implementing new policies to include staff alerts in the clinical workflow. Method and design. This was a QI project that had no patient participation or engagement. Only minimum patient information necessary to achieve the project's goal was collected. Data was collected at multiple points during the data collection period. A data collection tool that was designed for this project was provided to the clinic manager. The clinic manager compiled a list of patients seen in the clinic during the data collection period. Once the data collection period was over, the clinic manager provided the project's author the written list and EMR access password to the charts that were of the patients seen in the clinic during the data collection period. The project author conducted a retrospective chart audit of the EMRs in the list to ensure that they met the inclusion criteria, which included adults ages 18 to 65 with a diagnosis of depression. These were new and repeat patients for the clinic. The project period was from May 15, 2025 to October 15, 2025. Pre-intervention data was from May 15, 2025 to July 15, 2025, while post-intervention data was from July 16, 2025 to October 15, 2025. The project author reviewed all these charts, and after the completion of the retrospective chart audit, the written list and email password were returned to the clinic's manager for destruction according to the clinic's policy. Sample. For this QI project, writer consulted with Maryville statistician Dr. Pauls to help determine how many charts were needed for the sample. Using G-Power, Dr. Pauls determined that a minimum of 154 charts were needed, 77 for pre and 77 for post-intervention comparison. However, 260 EMRs met the inclusion criteria and were included in the sample for the pre- and post-intervention period. Data analysis. Data analysis is the processing and manipulation of raw data to answer research questions or confirm hypotheses. It helps draw conclusions related to research questions. Data analyzing tools are used to help readers understand and interpret the collected data. This quantitative project used numbers as variables for testing. For this project, Dr. Pauls, the Maryville statistician, used the G-Power and upper tail z-test for the difference of two proportions, a directional form of the chi-square test to establish the statistical significance in the frequency of pre- and post-intervention PHQ-9 compression rates. Cohen's test was used to calculate the effect size of the difference between the two groups, that is, the pre-intervention and post-intervention groups, and yielded an effect size of 1.02 and a G-power of 1. 95% confidence interval level was used to indicate the range of increase between the pre- and post-intervention PHQ-9 compression rates. 0.05 level of significance was used to determine the strength of evidence needed to reject or accept the null hypothesis. For this project, the p-value was less than 0.01, which was lower than the 0.05 level of significance that was used. Results. Pre-intervention PHQ-9 compression frequency was 38 charts out of 130, and post-intervention showed 101 charts were completed out of the 130 patients that were seen. The results indicated a statistically significant increase in the post-intervention PHQ-9 compression forms. The confidence interval showed an increase in the form compression between the two periods. 0 was not included in the interval, and it can be concluded that there was a statistically significant evidence of change in one direction. According to the results, there was a 48% increase in post-intervention PHQ-9 compression rates. A pie chart was used to show the difference between the pre- and post-intervention form compression rates. The pie chart makes it easier and possible for the readers to understand the impact of the staff alerts in the pre-intervention and post-intervention PHQ-9 compression rates during the two periods. Limitations. The provider did not have enough time to determine why patients were resistant to completing the forms pre-appointment. Additionally, there was no interaction with the patients to find out why they were resistant to complete the forms. Thirdly, there was no way to monitor if staff responded to staff alerts as expected. Completed PHQ-9 forms were electronically transmitted to the EMR for provider review, and it was assumed that all forms received prior to appointment were sent following the staff alerts post-intervention. Discussion. Provision of evidence-based patient-centered care is essential in all healthcare settings. Usage of evidence-based assessment tools and practices is essential for patient-focused care. This QI project focused on the importance of such tools in practice. The implementation of staff alerts improved pre-appointment form completion, patient engagement, and quality of care provided by the clinic. Implications for practice. As stated in Brooks 2023, completed PHQ-9 forms helped track severity of depressive symptoms and facilitates treatment decision-making. Having completed forms before the appointment allowed the provider to prepare and tailor the care necessary for the patients based on their needs as stated by Cutler et al. 2022. Practices that implement evidence-based tools are better equipped to provide patient-focused care, which improves patient engagement and understanding of their illness, as stated by Balati et al. For this QI project, staff alerts had a positive impact in helping patients complete their PHQ-9 forms prior to their scheduled appointments. It also decreased no-show rates, improved continuity of care, and increased the clinical revenue, as well as improving the efficiency of clinical workflow. The implications of staff alerts specifically to staff are that an improvement of collaboration and teamwork, working along with technology, can help increase efficiency and accuracy in all aspects of the practice. Conclusion. It is clear that implementation of staff alerts was necessary to improve the quality and safety of patient care. The project's results showed that staff training, teamwork, and collaboration improved patient engagement and was essential for the standardization of screening procedures in the clinical setting. Use of evidence-based assessment tools helps monitor patient symptoms, provide patient-centered care, improve quality of care, and reduce healthcare costs, as well as improving resources utilization. The following slides are my references. 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 References.